right, good morning. This is Barb Wood. Good morning, Barb.
Good morning,
Barb's
Dr. Janine.
Barb's going to share with us a bit about her experience in her office. So go ahead, Barb, if you would go ahead and get started.
When I made the decision to come see Dr. Janine, I had been having problems with acid reflux for a number of years. My primary physician, other doctors, specialists I had gone to did not have an answer for me that resulted in making me more comfortable and reducing my acid reflux. In fact, what was done really caused it to be worse as time went on. I made the decision some time before that the medication they recommended to me was not working, and I stopped taking it. I went to Dr. Janine. I advised her of all of this and wanted to know what her protocol would be for acid reflux. The acid reflux was causing me many other problems, as it turns out. I believe it was because when I started following Dr. Janine's protocol, the other symptoms were gone. The acid reflux within 2 weeks was gone. I was very comfortable. The aches and pains I was experiencing left. I still have occasionally some. A lot depends on how adamant I am about following the protocol. I'm pretty adamant about it because I feel so much better. My energy level, I can't tell you how my energy level improved. I wasn't sleeping. I had a cough that was relentless, and it was costing me my sleep. When that subsided, and the acid reflux, I believe, was no longer a cause, I sleep sometimes as long as 5 hours a night. That was unheard of prior, and I haven't had that kind of sleep for a number of years.
That's great.
There's so many other things that I could go on and on about that have improved for me. I've lost 40 pounds in less than 6 months. That wasn't my primary goal, but it's a bonus I'm really happy with.
Sure.
The health benefits have been tremendous.
Were there any obstacles, anything that you felt might be an obstacle at first, or you had to consider before you started?
There were a couple of things that probably kept me from starting sooner than I did. One was insurance doesn't pay. So I had to decide that that expense was going to be mine and be willing to pay that. As it turns out, I find it's far less expense than I had anticipated it would be because of other benefits. I had to start reading labels. I really was pretty uneducated about what was in food that I had been eating. So I really had to teach myself to read labels. I'm a planner by profession. I'm a financial planner. So I had to start planning not finances, but I had to start planning how I was going to eat. There is a planning element to this. Honestly, overall, it cost less than I anticipated, and it cost me less time than I anticipated once I developed my routine.
Great.
The rewards are so worth it.
That's wonderful. I know you're so wonderful patient and so wonderfully compliant. That's really what makes it work so well. In closing, is there anything you would like to add?
I just want to let folks know that I came through the holidays. Not only did I not gain weight, but I lost more weight. I think the reason for that is because I didn't hold myself rigid. If I wanted something, I just didn't have much of it. I mean, there are so many temptations, and it's hard to break that habit, but I never felt it was a failure if I had one cookie. I just ate the cookie and knew I needed to be more careful. Don't consume too much sugar.
Sure.
It's so worthwhile when you think about how much better it makes you feel. And truthfully, My hope is at least I can grow older, healthier.
Thank you, Barb.